The active learning strategy we're utilizing tonight is gaming. And gaming has, according to Rawls and Russo and Billings and Halstead, has the advantages of increasing cognitive and affective learning, increasing retention. It's fun and exciting, and those things will couple with the active brain capacity and really help learners incorporate their knowledge and remember it longer. It'll increase the learner's involvement. Motivated learners have a better time doing this kind of thing, and adult learners tend to do well with games. It helps connect practice experiences to theory, and students learn from each other after the experience of the game. It's immediate feedback, and learning from gaming lasts longer when compared with traditional lecture. There are some disadvantages, and that may be that some students may feel like it's threatening or maybe not as competitive. It can be time-consuming and may be costly to purchase or develop. This particular one was web-based, and so it was free to download, and you can change it with whatever subject you'd like to do. It may be difficult to evaluate because of the different learning levels that are involved and that there are several players involved. And one of the things is the faculty must set guidelines so that the learning experience doesn't sort of get out of hand, so the game doesn't get out of hand. Some teaching tips for gaming would be that you really need to use it for reinforcement. It's not for new knowledge, so these are great review things. It's an open learning environment, and faculty really need to get out of the way and have the students do a student-to-student interaction and then just be there for a resource. And you can use it as debriefing used to debrief after the game and connect the game with the important concepts. So now, this particular information was on safe administration of chemotherapy. So we're going to play Chemotherapy Jeopardy. So we'll get going. Okay. And what would you like, Aaron, first?
We'll do spills for 200.
Okay. Spills for 200. Okay. The number of times you clean an area after a spill. Anybody know that answer?
3, I believe.
Aaron says
What is 3?
What is 3? You got to do it in the form of a question. And what is 3?
Very
Yay!
good.
So Aaron gets points.
One for that team.
One for that team.
Do I hit the house?
Yes. Alright, other team.
I heard a team member.
What would you like?
I'll take chemo hodgepodge for 100.
Okay.
Ooh.
Hodgepodge.
Chemo hodgepodge for 100. The amount of times an incontinent patient's skin should be cleaned with soap and water.
What is 2?
Let's see. And Alex says,
Ooh.
Oh.
what is 2 times? Yay! So we get another
Point.
Yay, another point. Okay. What would Katie? What would you like?
We will take spills for 500.
Spills for 500. Use this item to clean up powdered spills. That's a tough one.
I think it might be a moist or a damp cloth.
Okay, we'll see.
Something wet.
Something like
So what is it? Do it.
Question.
What is a moist or a damp cloth?
Yeah.
Ooh,
What is a wet absorbent pad?
Do we get them?
Close enough.
Okay.
We'll go to
Judges?
the judges for that.
Okay.
Okay.
I'll take protective equipment for 200.
Okay. Use 2 pair of these when administering chemo.
What are gloves?
Okay, let's see.
All right.
What is gloves? Okay, very good. We'll give you that.
What is?
Okay.
Go ahead, Aaron.
Oh,
Pick a good
we'll do a adriamycin for 300. I think.
Adriamycin for 300.
Okay,
Jenny?
adriamycin for 300 it is. Common side effect, also known as alopecia.
Do you know what this is?
Oh, go ahead.
What is loss of hair, I believe. I think.
Ooh, good one.
What is
Nice
hair
job,
loss?
Aaron.
Alopecia is
Nice
hair
job.
loss.
Alright, so you've got 5 and 2, 7. You get 1,000 points. And I
Ooh.
get
Better go.
Oh, you're keeping track there.
Never go big.
Yeah.
Go big.
Go big or go home.
300. I'll take protective equipment for 500.
He's into protective equipment.
Yeah.
The maximum amount of time gloves should be worn when handling chemo, drugs, and waste.
What is one time?
Okay.
That's a trick question.
Oh, the maximum amount of time.
You've already said your
Oh.
answer, Mr. Ed. You need to push
Mr.
the
Ed.
question.
Hit the question.
Hit the question.
Mr. Ed.
What is 30 minutes? Wah, wah. That is wrong. So, after 30 minutes, you need to get out of those gloves when handling chemo, drugs, and waste. Okay. All right, Katie, I think it's your turn.
Ooh, let's take chemo hodgepodge for 500.
Might. Maybe.
What absorbable soiled undergarments should be placed in?
Ooh. Can we talk for a
I
second?
think you can collaborate. We'll have collaborative learning here.
Yeah.
You go ahead, Jenny.
Just you should make sure it's sealed. The sealed
You
bag.
have to form it in.
What is a sealed plastic bag?
All right, we'll
Ooh.
see.
A sealed bio bag. How about that?
Oh,
Okay.
That's-
you might be
that
right.
sounds
I
weird.
incorporated some of your answer in there.
We're not really sure.
What is a
you're
sealed
right.
plastic
Plastic
bag? All
I was a
right.
little close.
Bio bag should be more specific because it should be.
Biohazardous waste, right?
That's what I said.
There you
Yeah.
go.
You're
Okay.
smarter than the game.
We haven't had anything in bleomycin.
Yeah, because I don't think anybody knows how to pronounce it.
That's why. Go ahead.
I'll take bleomycin for 100.
Okay.
Oh,
Going easy.
going big there, aren't you?
Bleomycin is this type of chemo drug.
What is an antibiotic?
Ooh, good one. That's a good guess.
Yes.
It's a good guess. Let's
Better
see.
than what I would have said.
Mm-hmm.
What is an anti-neoplastic?
Close.
Oh.
Got the first
Antipart. Good.
prefix.
Your turn.
Was it my turn?
Yes.
We'll go. What did we not say yet? Spills for 400. Did we do that one? I don't think so.
It spills for 5.
I don't know. Person responsible for cleaning up a chemotherapy drug spill.
Person responsible. Who would that be? Got any?
I don't have any very good answers.
You don't have any good
I
answers?
would probably.
That's either-
Dun, 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 dun,
Ooh.
dun,
You think the?
dun, dun.
Go ahead. Form it in the
What
question.
is a pharmacist? Maybe.
Okay, let's see.
Or doctor.
No.
Oh, a doctor cleaning up those chemo spills.
Am I right?
What
Well
is
done.
the nurse?
Wow.
I got that mixed up.
Final answer. Meh.
Okay.
I don't know.
Okay.
Have we had any adriamycin?
What is adriamycin? Okay, I'm gonna take adriamycin for 500.
I think we did that. I think I did that one, didn't I?
Hold on, let's see.
Let's see. Oh
no. I don't know this.
Adriamycin is
Maybe.
also
no. So known by what other name? Give it up, Ed. You're not going to know this.
Oh.
Very encouraging.
Jenny, I don't know the answer to this one. I'm sorry.
You can't go to the
Your time's up.
question. And that would be doxorubicin.
Oh, yeah, you
yeah.
It's the old
Remember
doxorubicin.
I'm sorry.
Foiled again.
I must have missed that in my notes.
Yeah.
Okay, what's next?
Let's do bleomycin for. Did we do 400 yet? No?
No, I don't think
400. Bleomycin 400.
so. No.
Oh,
Uh-oh.
oh,
What
hey.
happened there?
Oh, what happened there? Go back. Let's do bleomycin for 300. How about that?
Sounds good.
Yeah.
That was a little snafu in the program. To assure that patient is not having harmful side effects, they may routinely receive one of these.
I know this.
You'll have to collaborate with
Oh,
one
we're
another.
collaborating.
I think it's a chest X-ray.
Oh, good idea.
Yeah.
What is a chest x-ray?
Okay, let's see if you're right.
Very
What is
good.
a chest x-ray?
Alright.
Now, at the end of the game, we have Final Jeopardy, so let's go to Final Jeopardy, I think, about now.
Ooh.
Let's see.
Yeah.
Oh, our Final Jeopardy question didn't come up. Oh, well,
Do you know it?
don't know how to get the Final Jeopardy question up. I do know what the Final Jeopardy
Oh, wait a
question
minute.
is.
I bet I can get it.
A little snafu with the
Little technical
a
difficulty.
little technical difficulty.
Oh,
We
oh.
know we've had technical difficulties. And our Final Jeopardy question
I bet
is.
it's gonna
I
go
won't
right to
answer.
this room.
You did.
Yeah.
I did.
Our Final Jeopardy question is, if there is any question when administering chemotherapy agents, what is the person to call? Ding.
Ding. I bet.
Oh, and there's the answer. What is
A
the pharmacist?
Yeah. Not to clean it
Okay.
up, but
Very good. Everybody, oh, there's the Final Jeopardy
That's
question.
right.
Somehow we got it. And so, this is the person you should call if you have any question when administering chemotherapy.
as
And
I got
certainly,
mixed up earlier.
yes.
Okay,
think
write
it's
your
the-
answers down and.
What is the pharmacist? So as you can see, gaming is a really fun and instructional way, and it's a really active learning method for students to participate in. It's great for review. You can use all sorts of games. These are free to download off the internet, and you can use it in any kind of format or setting, anywhere from art to teaching to nursing, of course. And so we think gaming is a really great way of active learning. Yay! Thank you, everybody.